on 680 CJOB. Raywat Deonandan, mask up or mask down?
You know what I'm going to say. I think we have to keep the mask for a bit longer, and the reasons are that the crisis isn't over yet. The majority of people are not vaccinated, which means the majority are susceptible still. Masks are a proven way of slowing down transmission. We don't yet know how vaccines work in terms of preventing actual infection. We have a good idea, but we don't really know that well. And we have evidence from places like Israel that did away with masks, and guess what? Brought them back in, even with the highest level of vaccination in the world, because they're not quite there yet, and Delta is still a threat. So my opinion is, hang on to the mask a little bit longer. They're a low investment, easy to apply, low risk mitigation tool, and the easiest one we can use. So why not keep it a while longer?
Raywat, some people might say, you're double vaxxed, Julie's double vaxxed, so is Richard. What are you guys worried about? If you trust the vaccine, don't worry about it.
Vaccines are great. They're not perfect. And with Delta, we're getting some conflicting data about exactly how efficacious 2 doses of the mRNA are. Is it 64% or is it 88%? We don't know. But either way, it's not perfect. So the thing about vaccines is like, I've been likening it to wearing high boots in a flood. If the boots are higher than the floodwaters, you're great. But if the floodwaters are a little bit higher than the boots, your feet are going to get wet. So while the transmission is still high, it's important to not trust the boots entirely. It's important to not trust the vaccines entirely. You need that extra little bit of effort that the masks provide to give us that effect. Now, if you're vaccinated, you can still pass it on to someone else, improbably, but it still happens. But that probability increases as the transmission rates increase in the community. This is a game of layering probabilities, and masks lower that probability substantially.
That's a good Red River flooding analogy, Raywat Deonandan, and we appreciate that very much. I will feel comfortable wearing a mask for several months to come, even when the mask mandate comes down. I just think that for a lot of us, that is the new normal until this is completely, if at all, eradicated.
Yeah, it's possible for people who cannot be immunized, for those under 12 for the moment, for the immunocompromised who cannot receive a vaccine and who are terrified by this disease. It's not an untoward thing to always wear a mask when you're indoors or in public transit or around strangers. It's the norm in Asia during flu season, so this isn't without precedent. My spouse is a doctor, and I have a bet about whether or not here where we live there will be a mask mandate by Christmas. I think there won't be. She thinks there will be. And I hope she's wrong, but I'm starting to think more and more that she might be right. It's not going to be the permanent normal. It might be normal for a bit longer than we thought, that's all.
When you look at Manitoba's vaccination rates, we are within a hair's breadth. Well, we probably crossed it today. We just don't have the official data. 74.8% of eligible Manitobans with the first dose, 50.2% have been fully vaccinated. So if you throw that 0.2% over there, we've hit that 75-50. That is certainly not the case in all provinces, and we have been a little bit slower with the third wave and eradicating that third wave. So is it maybe a good test to watch and see what our Western neighbors, how they fare with their mask mandates?
Absolutely is a good test. Learning from other jurisdictions is an important aspect of pandemic management and something we haven't done a lot of, to be frank. We've learned a lot from watching China at first, then Italy, then France, then the UK, a little bit from Sweden. And now we get to watch our provincial neighbors a bit too. I'd rather if our neighbors weren't experimenting too rashly. I'd rather if people were protected and we learn from, other mistakes elsewhere. But if people are going to do these things, yeah, let's watch carefully. Look, I'm rooting for them. I hope things work out well. But again, I err on the side of conservatism.
So with that 75-50 target being met, Manitoba could move into the next phase. We're certainly not hearing those signals will be imminent, but we're asking people in our question of the day if they would let unvaccinated people into their home, or if they would want that proof that they've been double vaccinated to be at their wedding. Is that irrational thinking?
Not at all. It might be the norm for a while. Israel had the Green Pass, which is a thing that allows people to get into restaurants and movie theaters that shows whether or not they've been vaccinated or they've recovered from COVID, or they had a recent negative swab test. Something to prove an immune status or a non-infectious status before you're exposed to other people. It's not an unreasonable thing to have. It may create, to some extent, two classes of people, but that's a short-term thing, and also nothing prevents people from one group from entering the other group. So it's an incentive to get vaccination, and nothing's being denied the unvaccinated. It just means they got to work a little harder to get into some things.
That question of the day is brought to you by Credit Aid, helping Manitobans get out of debt since 1992. Visit creditaid.ca, call 204-987-6890. With us from the University of Ottawa is epidemiologist Raywat Deonandan, Richard and Julie with you. The federal government's COVID app, not a game changer. It ends up that only 6.6 million out of the 30 million Canadians with smartphones downloaded it. Disappointing results. Say that was a success, though, that almost all 30 million Canadians downloaded it. Would this be a different story of COVID?
It might be, but simply downloading it isn't good enough. The question is, would the app work as promised? And in some cases, it wasn't working as promised. It was giving some false negatives and false positives. People weren't acting on the information, to get tested when they should have. So there's several factors at play here. One, you got to get the app. Two, it's got to work as promised. And three, people have to respond the way that the app instructs them to. If all three of those things aren't happening, then it doesn't work. In the future, when a pandemic happens again and we use apps in whatever technological capacity we can, we may have to rely more on the GPS technology and less on the Bluetooth technology. So take it out of the hands of people to make decisions and sadly, let Big Brother do his job.
And we heard that was some of the problems, right? If I had a positive test and I didn't ask the person on the phone for my code, then input that code, it was just way too much work for people. But we're also hearing from some experts who say it may have worked better, for example, in schools or in personal care homes. Is that something that should be looked at for the future?
Yeah, absolutely. Different tools for different environments and for different people. Relying on just one or two things to control this crisis is a mistake. We need a diversity of tools on the table applied to different scenarios, different populations, different demographics, different settings. So much to be digested and unpacked from this pandemic for the next public health crisis, because we will have more of them. And I hope we learn the right lessons from this and can move forward. But definitely, in my opinion, a heterogeneous set of applications applied to different populations is critical.
Raywat, appreciate the time. Thanks so very much for joining us again.
Thank you.
Raywat Deonandan from the University of Ottawa joining us at 4:40.